Well, hi there, everyone. This is Dr. Schroeder with this week's video introduction to week number 6 of our course in patient and staff education. Once again, a very nice week of discussion. The last couple of weeks, we have been talking about patient education primarily. And in the previous week, we had discussed patient education from a rather broad perspective, talking about how to assess patient readiness for learning and readability of materials. And this week we shifted our focus to specific populations, in particular in this scenario that you were given. We have, I think all of us would agree, is a pretty challenging situation where we have our patient Sherry, who is a middle-aged female. She has schizophrenia. She suffers from diabetes, and she also has children who have complicated issues with asthma, and she's lost custody of her children. And so the scenario was that you're going to be coordinating with and giving feedback to a social worker trying to identify what would be the learning needs, or what would be the learning teaching needs that would be important for this patient. And I think that everybody pretty much for the most part hit all the salient points and all the important issues that are important to take into consideration when you're dealing with a population, a special population. Particularly with the mentally ill population, one of the key things to keep in mind is that because of the nature of many mental illnesses, attention spans tend to be short, and therefore education needs to also be very short. You can't sit somebody down and give them a 1 hour educational video, for example, if they're hearing voices and if they are having internal stimuli or having symptoms of schizophrenia. Same thing would be true with bipolar. You have to really keep the teaching very short and limited in time, but it should be something that is repeated and given in multiple modalities. For example, little videos, written materials, and of course, teach back is something that was mentioned several times in classes, an excellent way of providing education. One thing that wasn't mentioned in the class that I had brought up in some feedback that it would be important to assess here as well is also identifying what are the support systems that this individual has. You know, what family members does she have to, or if not family members, what other individuals does she have in her life that are going to be able to offer her support? It's not likely that she's going to be able to care for her children on her own. And so one of the key aspects of the assessment would be identifying who are the family members or who are those support people going to be and what are their educational needs. It may be a family member, it may be a caseworker, it may be a home health aide. It can be any number of individuals, but that is something else that needs to be assessed. What are their education needs and how can that be given to them to help them with the support of this particular individual? Also this week, I have graded all of your PEN papers. When you review my feedback, please realize that for those of you that received a lot of feedback on your writing and on your sometimes grammar, sometimes paper structure, little APA things. My idea here is not to try to beat anybody over the head with it or try to be critical of all of your writing. But it is important that you address your writing as much as possible, because when you get your capstone courses, the writing is going to become very important. And for nursing educators in general, it's important because much of what we do is writing for various audiences. And so having a writer's voice that is scholarly, that is clear, concise, these are important aspects and important skills that we have to have in education. APA skills are also important, so all those little T-tag APA rules that it seems like I'm always kind of focusing on, they really are important in the world of scholarly and scientific writing, especially if you're going to be writing for publications someday. So remember, my feedback is really there to guide you and to help you. And so please review my feedback and let me know if you have any questions. In week number 6, we shift our focus. We're going to move away from patient education, and we're going to start focusing more on staff education in these coming weeks. In week number 6, we're going to go back to a concept that was mentioned earlier in the class. So if you remember, we had a discussion question where we talked about different state regulations and how different nurse practice acts have different requirements for CEU requirements. As when indicated at that time, not all states require CEUs of their nurses. However, those that do not require nurses to maintain their own CEUs, they all have requirements where a hospital is required to offer CEUs. And so that's how continuing education is ensured in the facility. Part of the method to the madness of that is that for those states that do that, they've determined that really the best person to identify what the educational needs are the educators in the hospital, as opposed to individual nurses themselves. And so that's why an argument can be made that having those requirements made, or the requirement that the CEUs be developed and maintained by a hospital does make some sense, because otherwise, if nurses are just told, for example, that they can go out and get 30 hours of CEUs in whatever topic they want, they may select topics that are something that they already know that they really don't need any help with. And it's because it might be perceived as being easier to do those kind of CEUs. So there is a, as I say, a method to the madness for why states do this. And so that's really going to be the focus of our discussion this week. You're going to be talking about identifying a hospital that has a requirement to provide CEUs, and you're going to be talking about the factors that are taken into consideration when developing an educational module. And so that's going to be the focus of your discussion question. Also, I'll be talking about the Week 7 assignment a little bit more detail next week, but you want to look ahead to that because it does require you to log onto a website. You do have to register for the website and download a QSIN simulation template. And I just want everybody to know to please review the rubric for that closely, because although this assignment requires you to download a template and use that template as a way of structuring your paper, it is not just a requirement that you download the template and type into it. As a matter of fact, that is not what you should do. So please don't look at the template and say, oh, okay, this is easy. I can go ahead and just fill in this template sometime this week. It does require you to write a paper, so it's going to be a paper that you write based on the information that is in that simulation template. But you're not going to be submitting the template itself, if that makes sense. So I just want you to be aware of that. So you want to look ahead as you begin to plan for that particular assignment. I will be grading the discussion questions later this week. Probably look for those, I'm guessing, on Wednesday for the grades for that. And I'll be active in class once again this week. It's kind of nice for me because there's no heavy papers to grade. When I grade papers, those papers do take quite a long time to grade. And so that takes up quite a bit of my time in class. And so this week's going to be primarily really focusing on that discussion of the staff education and the concepts that go along with that. I hope everybody had a great Thanksgiving. Mine was wonderful. It was kind of nice having a day out of class, and I hope that some of you got to take some time out of class as well and spend time with friends and family and doing all those good Thanksgiving things. So I look forward to participating with you in class once again this week. I hope everybody has a great week, and I'll see you in the discussion forums.